So, yeah, I mean, actually, this is guidance that goes back some years, actually. The original guidance was 2010. It's been updated since then. But what this is, it's sexuality education for very young children, and it's guidance that's put out by the WHO. And what this guidance effectively says is that children as young as 2 or 3 should be taught about sexual identity, gender identity, sexuality, and they should be encouraged to explore this. And many people, myself included, are very uneasy about this because a number of reasons why, but, you know, if you look at the actual substance of the guidance, it appears to be introducing very adult concepts to children very, very early. Once again, as with everything with the WHO, it is also a very top-down approach to health and education. So, you know, I think stepping back, one might ask, well, what on earth is this organisation doing, telling states what their education sectors should and shouldn't be teaching children? And the actual content, it's really, really troubling and it's really sinister. So just to give you one example in the context, this is all primary age children. It assumes that primary age children should be taught about consensual sexual matters and non-consensual. And I think many of us would say, well, hang on, that assumes that kids can consent to sexual interactions. I mean, you know, what are we talking? This is young kids, primary kids. So it's misguided, it's sinister.
I think it's terrifying. I mean, I think it's utterly terrifying, this stuff. I don't think children in primary schools should be taught any of this stuff, any of this gender ideology, any of this sexuality. I mean, that's for people in their teenagers. It's a major safeguarding risk. And you've got the World Health Organization. The thing is, if you don't understand something, I generally say, well, follow the money. What other vested interests in all of this?
Well, I mean, there's huge vested interest in the World Health Organization. I don't know about this guidance, actually. That I don't know. I think what is surprising about when this story broke, which it did, you know, it's across some of the papers today, the World Health Organization were approached to say, well, look, will you retract the guidance? You know, it is quite old guidance. And they won't. They stick by the guidance. And not only that, they have an implementation guide. So, and that is across a global implementation of this guidance. And there was a report issued a couple of years ago saying, actually, this guidance is, and I can't remember the exact figure, but it's only partially implemented across the globe. And that's not good enough. You know, we want all countries to adopt this sexuality education guidance. And it does look like some countries, so our government says it has not relied on it, it has not incorporated the guidance. We do know that other countries have, so it looks like Wales refer back to the guidance in their national sex education curriculum. So, you know, this has an impact and it permeates through, and I think it's many parents will be very shocked to understand that these policies.
And this is why it's so important we talk about it, because most parents in Wales will have no idea that, in fact, I didn't realise that Wales would. I mean, this is just utter madness. And then you've got concerns about the World Health Organization taking sort of essentially authoritarian powers in future pandemics. But before you know it, this will sort of extend into other areas like this.
It will, and I think, you know, it's a separate issue, but what the World Health Organization are proposing to do under the international health regs is exactly that. It's to give themselves binding powers that would, as the regs are currently written, override national sovereignty. And you have to look at the organisation's overall fitness for purpose. And I think, you know, it does have huge vested interests. It is funded over 80% by private interests. You know, pharmaceutical companies are very heavily represented in that funding. So this is not a democratic organisation. It's not an organisation funded by national governments. It's a funded organisation where private interests get to dictate policy.
It's truly unbelievable. But I want, you know, if we've got British representatives like Sir Jeremy Farrar on there as a chief scientist, I mean, I just think it's basic common sense that children shouldn't be taught this stuff, and he should be standing up and saying this guidance should be ignored. It's wrong.
Yeah, this should be a huge issue because I think many of us would say, why are we a member of an organisation that thinks this is appropriate for young children?
Well, we need to learn more and more about it. Chris in Horsham said, Molly, you are so sensible. Carry on like this and you'll be cancelled. You will not be cancelled.
You already have been.
They'll try it. They won't cancel Molly and they won't cancel me. That is for sure.